Dr. Tural, we have been talking about how vomiting for a baby can be, is a sign of dehydration can come about, and you need to do something about it if it lasts more than a half a day or day. What about diarrhea? Is there something which parents can look for, should look out for, and how does that work with babies?
Yes, babies, of course, could have just a diarrhea as a symptom, or vomiting and diarrhea as a symptom of something going on. Something is wrong with their stomach. When diarrhea happens alone, without vomiting, that could be still could lead to dehydration. An ongoing loss of like fluid from the body would make the patient dehydrated in a matter of a day, depending on their age, of course. If it is a young baby, they would dehydrate rather quickly. And then the thing to do, in a matter of half a day to a day, it would take for them to get dehydrated. What to do in a situation like that is to allow the patient to receive a lot of replacement fluids, like Pedialyte. It's over the counter, available in pharmacies and some food stores, and then that would be a great replacement of what they are losing. And then the next thing comes is how to make the diarrhea slow down and stop. That we use food items. In very young children, we do not resort to medications that stops the diarrhea. So there are two things a mother needs to do in a situation where there's only diarrhea. And one is to let them have food items that are sort of helping the child to have form stools, and the other one is to replace what they are losing.
Well, give me some ideas of some food items like that, because
food items would be like rice, would be saltine crackers, toast bread without butter, and saltine crackers, as I mentioned, and dry cereal sometimes helpful to consume to stop the diarrhea. If the baby kind of doesn't want to eat if the baby doesn't want to eat the dry foods, can she mix it up with a little bit of milk and stuff like that, or would that defeat the purpose again? No, it would be okay to do a formula, mixing the formula with the food item that we advise is, say, in a young baby, it would be a rice cereal. Rice cereal mixed with a little bit of formula would be a good intervention for a baby who has diarrhea. And there are some specific formulas that are designed to stop the diarrhea. So those typically have soy-based formulas, and then they do help their young infant's stomach to have that resolution of that symptom. But Pedialyte is an essential part of management of diarrhea, because as infant continues to have diarrhea means stool with water content too high. Too much water is lost in the stool. That means you have to replace that much of water by drinking, and that's the Pedialyte. Pedialyte is a special solution that has a little bit of salt in it, special salts, and then a little bit of sugar to optimize the absorption of the salts.
I see.
To replace
So two things. Replace right away with Pedialyte and with water, basically, but Pedialyte is a little enhanced, I guess. So it has a little salt and whatever, sugar, potassium, maybe, whatever. And then the other step is feed the child a little bit of rice and crackers, the type of stuff which I guess keeps the water a little bit more in the body. And I guess the third step would be, let's look at what causes that diarrhea in the first place. Maybe the baby is not accepting the formula you feed it. And maybe it was just a one-time little thing, kind of observe and take it from there, right?
Mm-hmm. Right, exactly.
Yeah? Okay. Wow, wonderful. But what you're saying here, to make sure we end us up with an important message, don't take vomiting and/or diarrhea lightly if it lasts for more than a half a day on a young baby, because the baby will dehydrate and that will cause major problems.
Exactly.
Thank you very much, Dr. Tural.
Okay.